He shall be called wonderful.
What makes a mother?
We're talking about a woman who is a junkie who would put her kid in a garbage can.
The woman who bore the child?
I threw him away. My baby.
Or the one who raised him?
It's my grandson. He should have liked you.
The heartbreaking story.
She wants him back.
You ain't gonna take my baby from me.
What are you gonna do?
Of nature versus nurture.
Look at my face. I'm his mother.
Jessica Lange and Halle.
Hello, my name is Jasmine, and today I'll be trying to persuade you to conform to my idea of not allowing drug babies to go home with their biological parents. During this presentation, I'll also be speaking to you about what exactly drug babies are, the risks they face before and after birth, and why I feel that they shouldn't be able to go home with their biological parents. According to the newsletter of WB, drug babies are newborns who are physically dependent on drugs and are usually exposed to drugs before they are born because their parents were either addicted or exposed to them during their pregnancy. And this picture up here is actually a baby that was born as a crack baby, and it's actually the size of a pen. And this picture is a picture of my little cousin. His name is Taquan. He was adopted by my aunt when he was a couple months old. He was born as a crack baby. And during that time, he had to be weaned off crack. He had to go through numerous processes to get to where he is today. And he's 2 now. So now that you know what drug babies are, I'll be talking to you about the different risks they face before and after birth. Prenatal drug exposure can cause serious injury and even death to a developing fetus. Also, fetal length and head circumference, and a variety of physical complications, including the formation of the heart, lungs, and genitals. Drug babies are more likely to exhibit behaviors that could limit their ability to learn and develop socially. Now that I've given you insight on the risks that drug babies endure before and after birth, I'll now be talking to you about my reasoning why I feel these babies shouldn't be allowed to go home with their biological parents. Some parents of drug babies don't try to seek help, henceforth causing a greater risk for their young. According to doitnow.org, some parents still continue to abuse drugs even after they give birth, which causes them to abuse their child. Lastly, I feel that babies shouldn't have to go through these things just because parents fail to fulfill their parental duties. So during this presentation, I've told you what drug babies are, as well as the risks they face before and after birth. Also, I've given you my view as to why drug babies shouldn't be able to go home with their biological parents. I hope you've conformed to my idea of not allowing them to go home with their parents, as well as being informed about this devastating issue. Thank you for your time.